At LUX A Medical Spa, the #1 procedure we offer is Botox Cosmetic and Dysport. So we have a list of all of the frequently asked questions that our patients have asked over the years and submitted on Facebook and Instagram recently. So Kylie is here with us to answer those questions. The first question, Kylie, how old is Botox?
So Botox was first FDA indicated in 1989 for 2 rare eye muscle disorders, and then about 20 years ago, it started to become FDA indicated for cosmetic use. It's FDA indicated for use in 98 countries.
How about Dysport?
Dysport was FDA indicated in 2009, so it's been around for 15 years.
And what is the difference between Botox and Dysport?
So they're both neurotoxins, so they're both injected into the muscles to stop the contraction of the muscle. The difference between the two is Botox seems to have not as quite as much spread as Dysport. So I think that Botox, for me as an injector, I like to use it in those deeper lines, so say in between the eyebrows. And then I love to use Dysport around the eyes and those crow's feet and just give a little bit more spread there.
How many units of Botox do I need?
Okay, well this obviously differs from person to person, but the FDA indicated dosing amount for Botox in all 3 indicated areas, which is the forehead, between the eyebrows, and around the eyes, is 64 units of Botox. That does differ, obviously, from person to person.
Next question, does it hurt?
It feels like a little bit of a pinch. I mean, of course, it's a needle going into the skin, but as an injector, I always like to pre-numb the area with ice to make it a little bit more comfortable. Takes only 5 minutes, so it's not too bad.
How long does Botox or Dysport last?
Perfect. So Botox is FDA indicated to last about 3 months. Dysport is FDA indicated to last anywhere from 3 to 4, but I always tell people dosing does equal duration. So that's where that FDA indicated dosing amounts do come in handy.
So what happens if it wears off too quickly?
That just means that you did not get enough dose. So if your Botox is not lasting as long, it's not lasting that 3 months, then we need to add a little bit more. I do tell all of my clients that Botox, of course, it doesn't just wear off in one day. So you're not gonna go to sleep one night with no wrinkles at all and wake up the next morning and they're all back. It is gonna be gradually kind of dissipating in the body. So around that 8-week mark, you're gonna notice a little bit more movement. But of course, if all of your movement is back at 8 weeks, we need to up your dose.
How long does it take for Botox or Dysport to kick in?
Okay. So Botox, usually I tell my clients it takes about 3 to 5 days to start noticing that lack of movement's not going to be completely gone. Dysport usually kicks in within 1 to 3 days, so it has a little bit of a quicker onset, but both products do take 2 weeks to fully work.
What happens if I'm uneven?
If you are uneven, we do offer complimentary 2-week follow-ups so that we can do a dose adjustment. So if you are uneven, it's nothing to worry about. We can adjust it, and then at your next treatment, we'll have it perfect.
What are the possible side effects of Botox Cosmetic?
Honestly, with Botox, there are not many side effects. Of course, we're using a needle, so bleeding, bruising, swelling, all of those are absolutely possibilities. Of course, we can have a little bit of unevenness, which, like we said, you can come back at 2 weeks and we can adjust that. But other than that, sometimes a headache afterwards, that's not uncommon. Doesn't always happen, but that's a possibility.
Outside of facial cosmetic procedures, what can Botox treat?
Botox can treat a lot of things since it was obviously FDA indicated for those eye disorders in 1989. There are plenty of things. We use it obviously cosmetically, but it can be used for hyperhidrosis, so excessive sweating. It can help with contractures, and it's been used in bladder spasms and bladder issues before too.
So what areas of the face or fun areas can you treat with Botox?
Perfect. So Botox can be used obviously for the FDA indicated areas, so the forehead, around the eyes, and between the eyebrows, but we can treat it, I can treat all kinds of areas. I've treated the neck, the platysmal bands, the masseter muscles, the trap muscles. We can do bunny lines, the lower face, underarms for sweating. It can be used in a lot of places.
Is there any downtime with Botox or Dysport?
There's not really a lot of downtime. There are a few things that you're not able to do after Botox. So I always tell my clients, immediately afterwards, there will be no exercise for 24 hours. So that day, get your exercise in prior to. We don't want you laying down flat for at least 4 to 6 hours, and same thing with bending down. I do tell all my clients, if you drop something and you pick it up, that's not gonna ruin your Botox, but if you're in a downward dog position at a yoga class, that could actually move your Botox. And then of course, we don't want you rubbing on the areas, and we don't want you wearing makeup for at least 24 hours. So that's about the only downtime that you have. I mean, immediately afterwards, you're gonna look like you got a few bee stings in the areas where we injected, but within 10 to 15 minutes, that histamine reaction goes down and it looks like you did nothing.
Is there anything we should do to prepare for our appointments?
So in preparation for your appointment, obviously exercise beforehand because you won't be able to exercise afterwards. I do tell all my clients, come in with no makeup on your face, regardless if you wear makeup. If you don't wear makeup, I'm gonna wipe you down with alcohol anyway. And then obviously I don't want you taking any blood thinning medications, so aspirin, ibuprofen, drinking alcohol the night before, just because that does increase your risk of bruising.
When is the best time to get Botox?
Okay, so of course this is another question that is open to interpretation. So everyone is different. The way that we age is completely different. So obviously it is up to the client to decide when you want to get Botox. Of course, our goal is to be more preventative because down the line, of course, as we age, these lines get deeper and more set in. So of course, the earlier we start, the better off we can be. So many medical providers do say in your 20s and early 30s is the best time to start preventative-wise with Botox.
So is Botox cosmetic only for women?
Absolutely not. Of course, I think when Botox was first kind of out on the market, women were obviously gravitating towards it more. But now men are actually deciding to do Botox a little bit more. I was reading a study that said that men are mostly interested in doing their crow's feet first, and then they'll focus on their forehead lines, then focus on in between their eyebrows. But it's definitely becoming a lot more popular with the male population as well.
So do men require a different dosage than women?
Absolutely. As an injector, I do feel like men have obviously thicker skin, they have larger muscles, and they have stronger muscles. So of course, when a man comes in for a consultation, that might reflect that they'd get a few more units.
Men have thicker skin?
Thicker skin, well, you know.
Why does Botox make your skin look shiny?
So, of course, Botox, when injected into the muscle, it helps to stop the contraction. So, of course, if the muscle isn't contracting, the skin is able to kind of become smoother. There's no lines, the texture is helping. Botox helps with the pores, so then the light actually reflects off the skin to kind of give it a little bit more of a shiny look, kind of like a mirror.
Why doesn't Lux do Botox parties? This is a fun one, right? So Kylie, from your perspective, why does Lux not offer Botox parties?
I think a lot goes into a Botox party. I've never been to one. I've obviously never done one, but I like to have like a one-on-one conversation with my clients. I like to let them know everything that Botox can do, why I'm doing this. I like to show them mirrors. I like to draw all over them. I'm pretty sure at a party, nobody wants me to draw all over them, let alone probably take off their makeup that they applied for the party in preparation for Botox. So I feel like for me as an injector, Botox parties, they seem like a lot of fun, but they also seem like just come here and have a party with just me in the room.
Right. Well, and that's what I think at Lux, our mission is to be the premier medical spa. So part of that experience is coming into the office. The front desk staff helps with your alley points. We're able to schedule your follow-up appointments, which I feel like may be missed sometimes during Botox parties.
Absolutely.
And, you know, really just the, everything that goes along with it. We decide in person whether we're doing Botox or Dysport. So we're not taking all of that with us. And there's sharp containers and OSHA and bloodborne pathogens and all of that. And I just don't think, we've always thought that that's not something you want in your house. But mainly we want you to have the experience.
Yeah, and a lot of the time I feel like these people who go to Botox parties, which are fun and fantastic, I don't know if Botox is exactly what they need to fix the problem that they want. So of course, Botox is being thrown into all these places, and at the end of the day, at that 2-week mark, they might be like, well, this didn't address anything that I wanted. Just because, of course, when you come in here, Botox is only a part of what we do. We're talking about medical grade skincare. We're talking about microneedling. We're talking about dermal fillers in conjunction with Botox. We're talking about radiofrequency microneedling. It's all of these ingredients to get the best skin possible. So Botox is just kind of a part of that, which here, when you come in for a consultation, you get to learn about all of it, whether it be overwhelming or not, but it's all the ingredients that take to make the best skin and make you look the best.
Right. Well, I think people sometimes look for deals, and that's why they go to Botox party, or they're scared, so maybe they want to be with a friend. So I think that at Lux, you know, we still have ways you can save through like Ally and Ally Flash and joining our VIP app. And if you need a friend with you, bring a friend.
Bring them in, more the merrier.
Right. What is Ally Flash?
So Ally Flash is from the makers of Botox and Juvederm. So Allergan, they created Ally Flash as a means of saving money and giving people deals. So of course, when our clients come in, they can actually scan through the Ally app and scan the Ally Flash, and they can save money on Botox, save money on Juvederm type fillers. And it's kind of just like a fun way of just like rolling the dice and seeing like, do you get a special deal today? And I think that's awesome.
Yeah. So you'll get a text message right before your appointment to remind you to scan Ally Flash when you arrive. So if the front desk can take your phone and they can actually scan a QR code for you, and it'll tell you immediately if you are a candidate for any savings today. And we've seen $300, $500 off Juvederm before, but very commonly we'll see $50, $75 off for either Botox or Juvederm. And then you have 12 hours, I think, to use it. So it just helps you when you go into the room with Kylie to then be like, okay, well today I want to do Botox because I have $75 off to use. So if you are unsure if Botox Cosmetic is right for you, or you're not sure which one to choose between Botox, Dysport, or any of the ones out there, Kylie is always available for a consultation. She would love to bring you in and talk to you about how many units you might need, and we can quote you on site.